Cancer is largely a lifestyle-related disease. Okay, so the search for a cure for cancer is normally focused on one sort of cancer, one specific, not just in one sort of cancer, not just like breast cancer, but one particular aspect of breast cancer. When we in fact know that lifestyle risks relate to a whole bunch of different cancers and account for up to 50% of the risk for cancer. So in fact, if we can get people to moderate their lifestyle, we don't just address risk for one specific sort of breast cancer or one specific sort of liver cancer or one specific sort of cervical cancer. We can address risk for a whole bunch of cancers very effectively. So behavioural change is really the key to actual cancer prevention in the future. It is the magic bullet. What makes what we're doing here in Adelaide different from what's happening around the world is that we've developed very novel decision support tools that enable people to get this information in real time and make decisions for themselves based on their own risks that are relevant. The research is really about making the decision to act an easy decision to make. So it's basically trying to work out what can we do in terms of changing the environment or changing the information people have that make the decision to act the obvious choice, the easy choice. So what we do is we provide access to a decision support tool which tries to tap into people's conceptions, misconceptions, risk perceptions, confidence around screening, and provides them with individualised feedback that's relevant to their own concerns in order to inform their decision making. So each 5 to 10% increment in uptake has a massive spin-off in terms of decreased morbidity and mortality 20 years down the track.
When patients go in to have their treatment for their cancer, sometimes the drugs or the radiation that they're given can cause some really nasty side effects. We're going to be recruiting patients, collecting samples and looking to see what makes each patient unique and how that relates to whether or not they have side effects. And then what we're going to do is try to push that into a clinically usable tool to really be able to predict patients before they go into their treatment to see if they will be at risk of side effects or not. If we can actually go in and say, we've looked at your blood and we've seen that there is a bigger risk of side effects for you than some others, we're going to actually be able to put into place some supportive measures. So make sure before you go in and start to feel sick, you're already been given the opportunity to have some other drugs that will prevent the side effects or minimise the symptoms, so you really don't get to that point in the treatment where you feel very unwell. Wouldn't it be fantastic if a patient could come into the clinic, be told they're going to have this treatment and know for sure they're not going to have any side effects. They're not going to feel the nausea or the bloating or the diarrhoea. They're just going to go, no, I'm going to have this treatment, it's going to be as effective as possible and I'm going to feel okay during it.
New technology has given us tremendous insights, both into the patient's genetic makeup and how that influences the way they respond to a drug, but also in the field of cancer, for example, the patient's tumour. Increasingly we can identify characteristics of the tumour that may influence the way they respond to drugs. One of the key platforms, if you like, of our research is about identifying barriers to personalised medicine, and there are many. I mean, this is really a new way of delivering drugs. Some of these barriers are economic, some of these barriers are around the framework in which we use drugs in this country or in any other country for that matter. Some of the barriers are really around things like education, a changing way of delivering medicine, practice change, things like this. So we work to identify these barriers and then try and identify solutions to the barriers. Personalised medicine really involves the fusion, if you like, of diagnostics and medicine. And while that's not completely new, on the scale that it's going to take place in the future of cancer therapeutics, we've never had that combination. What we have, as I said, is an unparalleled ability to look inside the human being, if you like, and to identify why they respond in certain ways, how they respond, and to try and use that in a way that actually guides therapy. But really it's all about harnessing the benefits of the technology for the consumer as quickly as we can. The SACRC is absolutely fundamental in terms of establishing critical mass in key areas that are going to drive the future of cancer therapeutics. So from my perspective, what it can do is actually bring us together in a meaningful way to try and overcome some of the barriers that I've identified and to try and ensure that South Australians get the best possible cancer care in the most timely manner.
I'm a head and neck cancer survivor. I had a tonsil squamous cell carcinoma that had spread to my neck and tongue, stage 4, quite advanced, back in 2005. After that I had 30 rounds of radiotherapy with chemotherapy and a couple of major operations. South Australia is only a small state, and we've seen it fall behind the other states that are doing good things in cancer research. So by the collaborative forming and bringing all these groups together, we can get leverage to attract more funds, attract more researchers, and do more clinical trials here. And in the end, that will benefit the community as a whole because they can participate in that. Bringing consumers around the table as part of the collaborative is a key to ensuring that the outcomes are tailored to meet the needs of the community. So by forming this collaborative in South Australia, it'll attract some of the best researchers to the state, the best clinicians here, and the result for that will be better outcomes for the community.